Well, Bridget, they are calling this a huge public health win. Many in the legislature have been pushing to expand Husky for years, and they say this is another big step in the right direction.
Brittany is from Ecuador. She is 13 today, but last year she was 12, and she too, with our help, now is covered.
Monday, state lawmakers, advocates, and immigrants celebrated the expansion of Connecticut's Medicaid program.
Estefania has a very special designation because she is 13 today. She is from Ecuador. And at 9:04 this morning, she worked with Vivian Acevita Rivas from Fairhaven, and she has now been approved, and she is now a recipient of Connecticut Medicaid for the last 2 hours.
Starting July 1st, children up to the age of 15, regardless of immigration status, are now covered under HUSKY Health insurance.
My daughter is 13 years of age, and she has benefited from the program. She has been able to see an eye doctor, a dentist, and she has regular check-ins with her pediatric doctor.
HUSKY has slowly been expanding over the past few years. In 2021, state lawmakers passed a bill opening care to undocumented children ages 8 and younger, growing to include those 12 and younger in 2023.
You know, a few years ago, we came up with this harebrained notion of making sure that kids in the state should have health insurance coverage. And we put forward the idea, and we were told flat out that there weren't the votes to pass it. And we didn't get out what we wanted. We were initially able to only pass coverage to cover kids up through age 8, leaving 9-year-olds, I don't know, get a job.
Last year, some legislators tried to expand care to everyone 25 and younger, but the final bill, funded through the state budget, stopped at 15 years old.
I myself am a parent, and as parents, we have one job to do, right? We want to protect our child.
The program is currently serving 12,000 kids across the state, but officials expect enrollment to grow with this new expansion.
Still, about 60% of undocumented people don't have access to health care.
While lawmakers won't be back in the state capitol now until next January, there is still a call to expand HUSKY further next session in 2025. Some are aiming for 18 years old, while others want to push again for that 25 years and younger. But this will be a budget year, so it all depends on how much money legislators can agree to allocate.